Thanks so much for joining us today. We'll go ahead and get started now. Welcome to today's Hep B Hangout. My name is Kate Moraras. I am the Senior Program Director at the Hepatitis B Foundation and Director of Hep United. The foundation is a co-lead of Hep United with the Association of Asian Pacific Community Health Organizations. We are a national coalition, so this topic is very near and dear to our heart, and we hope to learn from it as well. And we're a coalition of actually about almost now up to 20 local coalitions, 4 of which are featured here today, working towards the elimination of hepatitis B. I wanted to go ahead and introduce our speakers. We have Niki Bannister joining us from New York City. Niki, if you could wave. Niki is the co-organizer of the New York City Hepatitis B Coalition with Nara Johnson, who couldn't be with us today. She is at the New York City Department of Health. In 2012, Niki actually led the first formal evaluation of the coalition, and she works closely with NARA to continue to improve and expand and strengthen the coalition. Niki is actually also, her full-time job is as Hepatitis B Program Associate at the Charles B. Wang Community Health Center in New York City. Next, we have Heather Lusk, who is joining us over the phone. Hi, Heather.
Hi.
Heather is the co-director of Hep Free Hawaii. Hep Free Hawaii is actually a project of the Chow Project, which Heather is the executive director of, and the Hep Free Hawaii is actually a grassroots campaign started by hepatitis advocates in Hawaii to bring attention to the epidemic of hepatitis B and C and liver disease in the islands. Next, we have Matt Johnson. Matt is joining us from Chicago. He is the program manager of the Asian Health Coalition. Asian Health Coalition's mission is to improve the health and well-being of Asian Americans and Pacific Islanders in Illinois through advocacy, technical assistance, education, and community-based outreach. And finally, we have our team from Dallas-Fort Worth, the DFW Hepatitis B Free Project. Hi, everyone. We have Jeff Dinh.
Hello.
Minh-da Lee. Nguyen, and Tyler Smith. Dallas-Fort Worth is a project, a coalition based out of the UT, University of Texas Southwestern Medical School. So we have all, I believe, second-year medical students here, or more, fourth year. So DFW is entirely medical students based, and with advisors, and it's an organization that provides free hepatitis B and C screenings to the local community and education. So thank you again, everyone, for joining us. Go ahead to our housekeeping slide here. I wanted to review some things before we start the Hangout. Wanted to let you know, if you're hearing audio feedback to your speakers, you may want to switch to the phone line, and the call-in number is right there, 323-920-0091, and the access code for participants is 733-4209. Also, finally, if you have any questions during our Hangout, even during the discussion portion, please feel free to use the chat box on the lower left-hand corner of your screen, and please direct the question to the presenters or to me. We will have an open question and answer period at the conclusion of the discussion portion of the Hangout. So we're going to go ahead and get started. As I said, today's Hangout is on coalition building and maintenance, something that we as a national coalition are continuing to work on and learn from our local coalitions, something that the public health community uses as a strategy to make sure that whatever disease or public health issue is made a priority on the national scene or the local scene. So we thought this was an important topic for anyone, whether you're working on hepatitis B or any other diseases or any other public health issue, would find it useful. And I hope that you will find it useful and would be able to apply this and the lessons learned from today, and specifically on hepatitis B, to your local community, or if you're looking to build or maintain your coalition. So I'd like to go ahead and start with a question for everyone, but I'd like to go ahead and direct this towards Niki first. So just wanted to start off by learning a little bit about what everyone's doing in each of the cities. Tell us about your mission, your coalition, as it relates to addressing hepatitis B and the communities that you serve. Tell us about some of your activities as well. So Niki, I'll turn it over to you. And we can go on to Niki's slide.
Okay, hopefully everyone can hear me well. The New York City Hepatitis B Coalition was founded in 2009. It was founded by the New York City Department of Health and Mental Hygiene with the NYU Center for the Study of Asian American Health, B-Free Seed. The official mission is to build community capacity for the effective prevention, screening, and management of hepatitis B by promoting collaboration amongst key stakeholders and affecting change through education, outreach, and advocacy efforts. The coalition is unfunded, and through my evaluation in 2012 and 2013, there are over 30 active organizations that attend one of our regular quarterly meetings in person. As far as attendance, there's usually about 19 to 37 members that attend the in-person meeting and roughly around 50 active members. As far as activities, we do have the in-person meetings quarterly. We also do, as you can see from the pictures, press conferences for things like National Hepatitis Testing Day. We also participated in the Lunar New Year Parade. We had over 200 students participate and walk and hold posters about Hep B. The other picture here is from World Hepatitis Day, where we were in Times Square. And then the other picture is a few of the volunteers at a health fair. So those are some of the activities that we would participate in. And then, of course, we support the other organizations' screening events or outreach events.
Great, thanks so much. And we will delve deeper into how you've been able to bring 50 members into a coalition in New York. I'd like to now go to Dallas-Fort Worth. If you can also talk a little bit about your coalition and some of the activities that you're doing in your community.
Okay, so I'm just going to start off by reading our mission statement. So the DFW Hepatitis B Free Project aims to increase hepatitis B virus awareness and reduce prevalence of undiagnosed chronic HBV infection among susceptibility among Asian Pacific Islanders in the DFW Metroplex through education, screening, follow-up, and provision of treatment resources to the population. And so this is kind of the mission statement that we had. It could be updated a little bit because we also have expanded community outreach to the African communities, and we also plan on expanding in the future to the LBGT communities as well.
Interesting, great. And now I'll go ahead and go to Matt in Illinois.
Great, yeah. So I have a few slides if you could bring them up. As Kate said earlier, the mission of Asian Health Coalition in Juneau is to improve the health and well-being of Asian Americans and Pacific Islanders in Illinois through advocacy, technical assistance, education, and community-based research. And just I'm going to go very quickly through this is just some background about Illinois and kind of the population we deal with, and the states in general. So as you can see here, the first slide, Asian American population growth is increasing 46% from 2000 to 2010, and compare that to the rest of the populations. Specifically in Illinois, Illinois has the fifth largest Asian population in the nation, the largest in the Midwest, and more than 80% of that population resides in 4 counties within Illinois, and these are counties near the Chicago metro area. 85% of the individuals come from 5 subgroups, namely Asian Indian, Filipino, Chinese, Korean, and Vietnamese. And 45% live in just 12 cities and townships. So it kind of paints a unique picture that we have out here in the Midwest and in Illinois specifically. And as I think we're probably all aware to some degree, 50% of those infected with hepatitis B in the Asian American population, 75% of those don't know they're infected. So I bring all this up combined with other issues that we've seen Asian Health Coalition saw in terms of access to care and knowledge. All this led to the HEP program being created. And the mission of the HEP program, and really the mission as we continue our HEP work now, is to help build the infrastructure and capacity of Pan-Asian communities, provide outreach and education, increase screening, and provide appropriate linkage to care. It's really a community-driven approach. And the HEP program, as it originally started, that was from 97 to 2001, it was a school-based approach. And from that, it kind of evolved into a larger approach. We partnered with a lot of community partners, and with their help and with their input, we made it a much more rigorous evidence-based community participatory model, really trying to gear it towards culturally appropriate linguistic education, screening, and really, again, that linkage to care piece as well. So as we do our work now and continue, it really is a community-based approach, really emphasizing our work with our community-based partners who are on the ground and also healthcare providers. And I think I'll leave it at that.
Great. And did I hear you say that you started out as a school-based approach?
That's right. It was a school-based approach for the first 97, I guess, first 4 or 5 years. Yeah.
Oh, okay. Great. Mm-hmm. We'd love to hear more about that. Before, I did not know that. And so finally, I'm going to pull up Heather's slide. Heather Lusk is joining us over the phone today. And so, Heather, are you there?
I am. Thanks, Kate.
Great. I'm your slide right now, so
okay.
Go, I'll turn it over to you.
Okay. So we've Hep Free Hawaii just hit its 3rd anniversary, so we're very happy to celebrate 3 years. And as you'll notice, our name is Hep Free Hawaii, not necessarily Hep B Free Hawaii. And that was because when we first started, even though we started with Hep B as our focus, as you can imagine, the majority of the 1.3 million residents of Hawaii are Asian American, Native Hawaiian, or Pacific Islander, the vast majority. And so our steering committee decided that it would be a missed opportunity for us to only focus on hepatitis B. So we focus on all viral hepatitis as well as liver disease. But I'm going to focus today talking about our hepatitis B efforts because then we do targeted, culturally targeted programs for hepatitis B as well as hepatitis C. And eventually we will be doing broader liver wellness as in addition. Were you able to get my slides up, Kate?
You know what? It is taking a little bit longer.
That's okay. That's all right.
So it's coming, hopefully. If not, while you're talking, we can always show it again later.
Okay, that's great. So, that's fine. Thank you. So again, I'll focus on our hepatitis B efforts. So our mission, which is on my slide, is our main mission is, like many of the folks here, is to raise awareness about hepatitis B, to encourage people to know their status, both their hepatitis B status as well as their immunization status, and to really encourage a linkage to care. We have a very comprehensive website, which I encourage folks to visit. It's www.hepfreehawaii.org, where we try to be a portal for both clinicians, the public, and the communities at risk. So we have over 60 partner agencies, and I'll talk more about why we have so many. Our active coalition is much smaller than that. We also include a lot of national or local coalitions in our efforts. But it's been a joy to have so many agencies to support our efforts. And some of our main activities is we do have free hepatitis B screening and immunizations at about 13 sites statewide. We do those at cultural health fairs and other events to outreach, like many of the folks on the phone. Then we also have two kind of cornerstone programs. One is a hepatitis care coordination program. So we're working with folks that test positive for hepatitis B. We have a social worker care coordinator on Oahu who will work with anybody who has hepatitis B and support them in understanding what that means, linking them to care, going with them to an appointment if necessary, and supporting them in getting the culturally appropriate care that they need and deserve. And then secondly, we have a round of in-language materials. We have some Pacific Islander communities in our state that have very high rates of hepatitis B and did not have any educational materials for them. So we started an initiative where we have in-language materials for Hep B in Tongan, Samoan, Chuukese, Marshallese, and Ilocano. And that's been a very successful part of our program. So that's a little snapshot on hepatitis or Hep Free Hawaii, and we're really honored to be part of Hep B United and the larger Hepatitis B Coalition movement.
Great. Thanks, Heather. And I'm sorry about those slides. So I'll continue to try to pull those up so that folks can read it later. And we can also share it via email after the Hangout as well. So thanks everyone for giving a little bit of background, and I hope that our audience members who aren't as familiar with hepatitis B at least gets a very basic understanding of the disease through each of our coalition members' work. I wanted to go ahead and start by asking everyone again just another understanding of how you started your coalition. Did you conduct a research assessment? What kind of background research, if so, what kind of background research did you have to do in your community in order to really just initiate a coalition? And so I'll go ahead and start with, I'll start with Matt, actually.
So kind of building off what I already spoke about, Hep B, our efforts here started school-based, and that was through various funding mechanisms. And then after that funding, we started to work more with our community partners and really try to emphasize a broader approach. And so we had the information from our school-based work. We had information from some of the partners that we worked with then. But we also went out and did a further evaluation and resource assessment with all community partners that we thought we could work with. There's initial assessments to try to identify who we thought we could work with, and then even more in-depth assessments after partners were selected. And the attempt was to assess the health needs among the communities that we work with from that organization's perspective. We also assist in the infrastructure of the HEP program itself, kind of knowing what's there and what might be needed from our partners and as well as from us. Organizational information, the target population demographics, perceived barriers to healthcare, and the organization's capacity to provide Hep B education and efforts for the community. So yes, resource assessments were a big part, and they continue to be. I mean, we keep tabs, I guess, on how things are going, and that's right. Incredibly important.
That's good to know, especially in terms of maintaining it. And what about you, Niki? Is that something that you guys also had to do prior to setting up your coalition?
So back in 2007, the New York City Department of Health started a hepatitis C task force, and with the success of that, in 2009, they decided to partner with NYU to do a Hep B coalition. But starting back in 2007, the Department of Health started to identify different sites that offer Hep B services and put that into a online site locator. And that's still being maintained today. So that's kind of a way for us to see who's out there providing vaccinations, testing, also treatment.
Great. So it's interesting how you, that's sort of like a lesson learned from Hep C, and things started from there. Doing our work nationally, we also feel that a lot of hepatitis C advocates, which is a larger community, I think generally have done, they've had a lot of successes, and I think at the same time, we're also trying to learn from them. So what about Dallas-Fort Worth? Just how did you guys get started? I mean, especially coming from a academic institution, I guess.
So it started as the APAMSA group, which is the Asian Pacific Islander Medical Association. every year they have a hepatitis B conference, and the first time that we went was in 2010, and they gave, it was a really good conference, and two of the people that came back from the conference were really inspired and motivated to start a coalition at our school. And so they reached out to the APANSA Medical Student Association here and said that it would be a really great idea to screen the Asian population here because we have like a very high Asian population. And so from there we started contacting faculty that were hepatitis that were really familiar already with the population. They really wanted to screen it, but they just didn't have the manpower to do it. And we had a lot of willing volunteer students to help them do it. And so that's kind of how we got started.
And just out of curiosity, is it all medical staff, or do you guys have community organizations or other, I guess, provider groups involved?
So we work with a lot of people. So part of the UT Southwestern Medical Center, we work with nursing students, PA students, and pharmacists. And then also the hepatologists advisors, they are part of, like the Vietnamese Health Professional Association in Dallas. And so we collaborate with a lot of different levels.
Great. And I see you have someone else that just joined. Do you want to introduce yourself?
Yeah. Hi, I'm Alex.
Great. So is this your coalition leadership team that you have here?
Yeah, part of it.
Okay.
The one available.
Okay, great. And Heather, what about you? What about in Hawaii? Could you tell us a little bit about any assessments or anything that you had to do, maybe specific to especially Native Hawaiians and Pacific Islanders?
Sure. Well, just to take a step back, we really originated because the American Liver Foundation pulled their chapter out of our state. And that had been really the only vehicle that myself and our top hepatologists and anybody involved in hepatitis B had gotten together to do statewide efforts. So when that left, we really felt a big, as we say in Hawaii, a big puka. So we did do an assessment and really identified that we needed to have something that was a statewide coalition to serve some of the same functions that the ALF chapter had, but to make it more Hawaii specific. So we started out with myself, our top hepatologist, and actually our viral hepatitis coordinator that's in the health department. So it's a great public-private partnership, which I've heard several other coalitions were as well. And I really believe that having the clinicians, having our top hepatologist, Dr. Tsai, and our liver transplant specialist, Dr. Wang, involved from the beginning really helped give us the credibility that we needed to be able to get in and get the data that we needed through our resource assessments. Oh, you've got my slides up. Thank you. So here's a bit about our vision and mission and goals. Thank you. And what we really found out is that, especially for Native Hawaiians, there's very little data on hepatitis B specific to Native Hawaiians. So that's really an area that we're looking to expand because there's very little data on that particular population, and yet our anecdotal data says that there is quite a bit of hepatitis B in that population. So we're looking to do more, and we've done some assessments around liver cancer as well.
Great.
And really finding that, at least in our state, it's over 70% of our liver cancer is linked to hepatitis B.
Great. It sounds like everyone did do some sort of, it's so interesting to see how different the coalitions work, but that they originate from different ways. It's interesting that some of them came from national organizations, some local initiatives, as well as learning from other disease focuses. So, when you started your coalition, I know that you guys did a little bit of an assessment, but you obviously had to choose a leadership structure or form a leadership structure in some way amongst your different organizations that you have as part of the coalition. How did you figure out who to approach first? Like, how did you get people on board, really? Because sometimes, I guess, we often encounter different communities work differently. Different communities work, and it really depends on your local environment and really sometimes there are natural leaders, sometimes there aren't. So any tips on who you needed on your side before you approached people? Dallas?
So for us, it just kind of came very piecemeal. First, we needed the support of faculty advisors, and so that's who we approached first. As a student organization, we had to approach the dean to get approval to, do these screenings. And after that, after we got the support of our faculty advisors, it was a lot easier to form relationships with other peer groups because establish more credibility. We're also working with the state of Texas right now. They provide a lot of our free screenings, and we wouldn't be able to do that without faculty advisors. And just going to a lot of the hepatitis B conferences, like the AASDL conference, we were able to make a lot of contacts through there. And they were able to, provide their support for us to just make more contacts. So it was it was all about building momentum and credibility for us as a new coalition.
Makes sense. And it seems like a common denominator here is the state agency, state public health agency or Department of Health, also getting them on board and as an ally and making sure that hepatitis B is on their agenda. And so, Matt, is that the case for you? What are your strategies to get buy-in?
So we have a community advisory board that we formed, first originally formed, and there's still one in existence that kind of co-evolves depending on who we're working with and the given time, I think. But originally it was formed based on members of the coalition and our partner-based, community-based partners, and they helped provide input and guidance on who to approach. And in terms of that, who we approached were really local area leaders with the input of the community-based organizations. So local area physicians, community leaders, public health department, coordinators, pharmacy reps, clinicians, academics, everyone really at the table who either had an interest in Hep B or in health or in improving their community or any of the above, really, and kind of, reaching on and latching on to those who were already on the table, so to speak, or at the table in one way or another. And that continues today with the work we do. Our community partners, they function as our community advisory board and help provide insight and perspective. So, really helpful.
Interesting. So I'm starting to get an idea for your structure there. And what about you, Niki? Do you have a leadership structure, and how did that, I guess, develop over time?
Actually, only recently have we instituted a advisory board made up of different members. But I think just at the beginning, having the Department of Health there, it offered some form of legitimacy and authority. And as far as just continuing to build the people and membership, inviting someone to speak at one of the meetings, they'll bring in more people and they'll come and then they'll continue to be involved in the organization once they see what we're about. So going to maybe the outreach staff first and then going to the higher levels has also been a successful strategy for us.
Great. And Heather, do you want to talk about some of the maybe barriers that you might have faced when starting Hep Free Hawaii?
Sure. I think for us, one of our biggest challenges was looking at the best practices that were getting done on the mainland and ensuring also that we kept it Hawaii specific. So that was, I think, a real important process for us to go through. I think secondly, our biggest challenge was not recruiting members, but really retaining and finding active roles for them, which I think we'll talk about a little bit later. But that definitely, we made it very low threshold to join as a partner, and then kind of had a second level of activity that we then asked folks to be involved with, and that second level was much more challenging. And then also because we have water between our counties, meeting has been very challenging for us, and we do much more virtual than we do in person because we just can't afford to fly people over from the neighbor islands, and yet we are a statewide coalition. And I'm sure other folks with large areas struggle with how do you bring folks together. Oftentimes the people you want at the table are very busy, so how do you kind of harness their energy and their time, but in a way that is, not going to interfere with their schedules and yet be meaningful. And so we're still trying to struggle with what does that meaningful face-to-face look like. So right now we're doing most of our stuff virtually, communication and meeting-wise.
Yeah, I think that definitely is becoming a trend. I mean, even at the, as part of the national coalition, I think face-to-face time is really important. Maybe once a year, like at our summits, but almost everything is done virtually. And again, we'll touch on this a little bit later about how to remain active and interested in the topic. And it actually sounds like there wasn't really a education that you had to do to get people interested. It seems like the ground was already laid out. The foundation was there to start your coalition, so that's good to know. And Niki, I know you had mentioned you had about 50 coalition members currently. Is that right? Just wanted to know, when is the growth in numbers of partners enough? How do you, when do you know when you reach capacity, or do you ever reach capacity?
Right. I mean, I think with everyone talking about how we're moving to a digital space in the coalition, there is no capacity. I mean, there's always room to grow. Even though we've had 50 members that are active going to the in-person meetings, we still have over 500 people on our mailing list. And they're able to participate in the different ways through social media or reading the meeting notes or in those ways.
Do you feel like there are any cons to growing at all, or having that many people, or no?
No, we need...
Not really, I guess, yeah. I mean, as a national coalition, that's something that we are talking about as well, about how much growth is it? You shouldn't even limit, I guess, because it's more like a movement. The more people that you have involved, even if they're not active, at least they're aware of it. That's something that, we ask ourselves too. So I wanted to go to the Dallas coalition. You are med students, so there obviously is a transition every, few years or year. So how do you cope with that? Has it run smoothly?
Well, the transitions are difficult because between second and third year, we generally lose a lot of members as they transition into the hospital.
Right.
But they generally in the fourth year. And to help with the transition between that time, what we do is there's kind of an apprenticeship for first years. So the first years basically help the second years, who are the main officers, and do a lot of the grunt work. And that's where they learn how to do screening, organize follow-ups, and so forth, education events. And really gives them like a year to learn all the different aspects of our group and what they like and how to improve.
Interesting. And you guys have been so impressive. I know that you have successfully gotten grants from different sources. I mean, how do you have advisors? Do you have grant writers? How do you make time for that?
We divide up, so we have several different officers to help divide up the work. And we have two treasurers. I'm one of them, and I, along with the other treasurer and co-directors, write grants. We have applied to Hep B United grants, PAMSA grants, AOA, and a couple of other little local grants. and we get advice from advisors, previous students, and cross our fingers and hope for the best.
But thank you. I mean, it sounds amazing what you guys have been able to do as a student-run organization, and we hope that, I mean, it's such a natural fit for medical schools to do Hep B screening, actually to be a pipeline for people who are looking to go into hepatitis B work and hepatology. So we hope that, you are able to be replicated what you're doing in other med schools, and, if you're interested, we'd love to probably work on something together. I wanted to turn to Heather, something that you mentioned earlier about keeping your members active, and that's something that Niki also mentioned. As people grow, there's a certain number of active members versus a humongous number of people that are on certain listservs. How do you keep people engaged, and how do you help people find their role in the coalition?
It's been an ongoing challenge, but a couple of our successful strategies include one is that we highlight a partner kind of the month on our website, and that seems to have been incentive for some of our partners to not necessarily be involved in some of our broader issues, but to do things on their own. And we encourage them, whenever you have a Hep B event or you do something related to hepatitis, give us a shout out or give us some photos, and we'll highlight you on the website. And we've definitely seen an increase in people taking the initiative to do their own events and then also let us know about them. But as far as how do we get folks involved in coalition activities, we've really found that we need to target specifically. So a great example is we did a call out for anybody that was willing to be involved in our screening events. So who would be willing to do the counseling or testing, who would do the phlebotomy. So we had a broader list, and then when we have an event, we actually go to each person specifically and say, hey, we have the screening event coming up, would you be willing to join? So we found that's much more successful than just a broad email or call saying, hey, anybody want to help us? No, we go down the list and say, Robin, would you be willing to help us on this day? And we find that folks are much more responsive when we go to them individually. And then finally, like many of you, we find the champion in our partner agency or in our coalition members, the champion at that agency, and really work with them to identify who is the power, who makes the decisions within their agency to help support their folks in being involved in broader coalition efforts, and try to find the links between their missions and their existing activities and how they can be involved in coalition activities and kind of meet both needs. So those are some of the strategies we've used that have been successful.
Those are really good tips. You kind of tell people to do things. Matt or Niki, do you use those strategies as well in keeping people engaged? Matt, go ahead.
Yeah. I mean, I think similar, and making sure that we kind of report out our activities and report out our activities of our partners and highlight the successes and highlight and celebrate, all the good news. I think that helps as well to add on.
Great. And Niki, you were nodding your head as well.
Yeah, we also do similar things. And again, we have, we have a website. We use MailChimp to send out all our meeting highlights and newsletters, so we can actually track who's clicking on, different articles or pieces, so we can make it even more tailored to our group and what they're interested in. The other thing is we have work groups. When there's a special interest, like in the Caribbean population or in Hep B birth dose, we start a work group and get people involved that way.
That's another really good strategy to give out, I guess, pieces that are more manageable to work on and not be feeling so overwhelmed with the larger mission. And I know that you are actually working on youth engagement, sort of working with college or even high school based. You had gotten a humongous number, like very large people involved in, I saw those pictures. Do you hope that they will get involved in the coalition? Is that one way, I guess, that you're developing leadership or fostering it?
Right. So we've we've partnered with Team HBV out in Stanford Liver Center, and we have a Team HBV in New York City, and they help us with the different outreach events. And with the high school students, they all have to have a certain number of volunteer hours, and by participating in our events, that counts. So that's one way to encourage them. And then while they're doing outreach events, they themselves know about hepatitis B. So hopefully when they end up, they're pre-med students and whatnot, they'll go to med school and think about Hep B.
Right. And then they can start their own project just like Dallas has. Matt, I know that the Asian Health Coalition has been around for quite some time, a very well-established coalition working in the Chicago area and Illinois with the API community. And you have taken this leadership role for some time. I'm just wondering, as leader of a coalition, what does your role become as it continues to grow? I mean, do you ever think about transitions? How do you share that role?
And I think we would say that our role has probably evolved over time, and as we see it now, we can see some of the impacts that we collectively have had as a coalition. And so seeing that and having some of that knowledge, we know that collectively we can see a bigger impact and achieve bigger results. And it's much harder to accomplish individually. And we see that, again, as a coalition, that building the capacity of our community partners and our ability to provide evaluation, kind of a broad overall evaluation of many aspects, that's a big strength, and I think we see that strength growing and perhaps our role moving more towards helping develop capacity, helping with evaluation and collecting data, helping with advocacy as we lead these organizations, or help lead together, really, as a coalition, forward into the future. So I think that's how we kind of see our role evolving.
Great. That is really interesting that you sort of do that technical assistance and build a capacity of your organization. We have about 10 to 15 minutes left before we actually turn it over to the audience members. So I wanted to ask one last question to everyone, and I'll start with Dallas. What's your parting advice on keeping your coalition going and the momentum going? And I guess what's your key ingredient? What is maybe one stakeholder that has been the key to keeping your coalition alive? Is it the state agency? Is it the funding? Is it the leadership? So whatever you would like to share as a parting advice for maintaining your coalition.
I think for us, it's mostly the leadership and having, members that are really excited to, go out into the community and help, these populations that we feel are underserved, and just to keep them, really excited and motivated. What we typically like to do is host, educational series where we talk about Hep B and the disparities of, screening and things like that. And then once we get the word out to students, I feel like that really fires them up to, go out and do something in the community.
Great. Heather, what about you?
I would have to say it's our website. Looking at the data, I'm amazed at how many hits we get on a regular basis. And I think one of the ways we do that is we keep it up to date. We put new things on every week. We put news updates. We highlight our partners. We make sure we take photos of every event we're involved with. So we're always trying to steer people to the website as a portal for hopefully the state's coordination of hepatitis services as well as education and awareness. And that includes getting media to come there and just trying to make it a place that everybody goes to. And so far we've been relatively lucky in getting some in-kind donations. And I really encourage folks, we got most of our website developed from in-kind donations from a pharmaceutical company who had no input into the content. And I think that looking at some kind of allies like that when they may be able to help with in-kind donations is sometimes easier than actual dollars. And I think that's really helped us make a dynamic, interactive website that, according to our data, thousands and thousands of folks are accessing.
Wow. Interesting. We will go to your website and definitely that's a really good point. Keeping it, I guess, as a resource that people go to. Yeah. And Niki?
So I guess my advice would be having a work plan, setting out dates for meetings or events ahead of time, having people put it on their schedule. A lot of people that do Hep B work, it's not a full-time job. There's usually not staff devoted to it, so it's very difficult to get people engaged. And then I agree with what Heather was saying with the website. That's very important. And then finally, I know that we're all working with API groups, but I think diversifying and moving out to all immigrant or foreign-born populations, we've found a lot of success engaging the African groups and the Caribbean and Hispanic groups. And that's given us a little bit more power for advocacy.
Right. Good to know. And Matt?
Yeah, I think we'd probably stress collaboration from our perspectives. Collaboration at the grassroots level with community-based organizations, community health workers, community leaders, collaboration with academics, with pharmaceuticals, with the healthcare system. Really, collaboration, I think, is key for the work we've done and continue to do.
Great. Thank you so much, you guys. I was also thinking about the Hep B United Coalition as a national entity, and really, it's a disease that really spans so many stakeholder groups, like you said, the corporate, community organizations, provider groups, individuals, and because it's a disease that disproportionately affects a specific community, whether it's African immigrant or the Asian American community, we are also thinking about expanding and making sure that organizations that don't only work on health issues, but work with on social service or anything serving those specific communities at large, get hepatitis on their agenda, because it's another opportunity to increase the awareness and also continue to build that momentum for our coalition. I want to now turn to the audience for questions, and so please feel free to use the chat box on the lower left-hand corner, and we will direct them to the presenter. We have a few here. From Philadelphia, Heather, you had mentioned that some of your partners do HBV events on their own. How did you get them to that point where they felt they could do HBV events on their own? And she says in our coalition, they still turn to us for all HBV event planning.
Right. Yeah, no, that it is. It definitely took some capacity building. So what we did, for example, this is specific to one of our islands that's really taken on. Actually, they have now a hepatitis B elimination project on Kauai, where they're trying in the next 3 years to eliminate any new hepatitis B infections and test everybody on the island. It's quite an amazing initiative. And that really started from us going over there several times, which I know takes resources, but we did trainings on hepatitis B. We then supported them in getting a CME speaker over there to do trainings for their clinicians on hepatitis B. And then the biggest one, honestly, was that they really connected with we helped them connect with the Filipino community on the island, which represents a very large, almost 40% of their population. And that's actually where I think the snowball started, was finding the folks in the community that really said, hey, we can make a difference on our little island. And so we kind of just tried to provide the resources and trainings, and then they took the ball, ran with it. We also supported them with some grant writing, and they got a big grant to support their hepatitis B efforts. So try to really just look at it like we were a capacity capacity building provider with them in any way that we could give that support. And the grant writing piece is a big part where we would basically give them pieces of grants that we had written before and say, hey, go ahead and use any of this. Here's all the data on Hawaii and Hep B. Here's everything you would need. Feel free to use it. And actually, several of our members now have used some of our grant data and gotten their own grants. And I think that's a really powerful model. It's like, who cares? We don't get the territorialness. Any money that goes to hepatitis in our state is helpful.
Great, thanks. And then we have another question. Coming from British Columbia, Canada, where viral hepatitis B is not as emphasized as other infectious diseases, how do you get organizations to be interested in joining the fight against hepatitis B in the first place? I know you all had talked a little bit about getting your coalition started, but there was already some of the groundwork that had been laid from the hepatitis C community, from liver disease organizations, maybe even being part of the medical. But so maybe just wanted your thoughts on that. Maybe I'll go to Matt, just as an Asian health coalition as large.
Excuse me. I think some of the earliest things we did to bring awareness was going into the communities of the populations who are most affected. For example, church organizations. It needn't be large groups necessarily, but I guess seeing who's out there who may have an inherent interest in it because it may affect them more than others would be a possible approach one could take. That I think we did in the beginning, and we still do. We find churches and organizations that have an interest in learning more about Hep B, and we're glad to work with them.
Great. And Niki, do you have any insights from New York?
I think it's a challenge that even here in New York City we're facing.
Yeah.
Not only are we competing against other infectious diseases, right now we're competing against Hep C. They're getting all the dollars, they're getting all the attention. Trying to get patient advocates with personal stories, that seems to work on higher organizations. But it's difficult. It's going to be a struggle all the time, I think.
Yeah, I agree. So Alan from Vancouver, I mean, hepatitis B is competing against major infectious diseases. It's not something that any of us actually here in the States as well are continuing to work on to increase awareness. Actually, if you want to look at the U.S. Department of Health and Human Services just released an updated version of their viral hepatitis action plan. One of their strategic priority areas is not only community education and awareness, but also provider education and awareness, something that we are continuing to work on in various ways. In Dallas, I know you guys are a little bit biased because you are in the medical field, and was it something that you, coming from the provider perspective, how did you hear about it? Was it in your curriculum at all? Or was it something just from a PAMSA?
I mean, it was in our curriculum, and also I think like the faculty advisors, the hepatologists that know a lot about hepatitis B epidemiology, they were really good at just educating us on I guess the disparities in hepatitis B awareness, and so I think a lot of it has to do with just like the faculty educating.
Mm-hmm.
We also have every year we all host like a week lecture series that give out raising awareness about hepatitis B and C, how preventable it is, and how the prevalence of the disease and its effect to the student body here. So that's how I knew about the group in the first place. And so we do that every year to try to get new members to come in. And
yeah, I guess it's like have it on repeat, just be in, just continuing to talk about it. I think is definitely a strategy. We do have a question here, another question here. Hi, I'm from Zimbabwe, but in Norway for studies. and is the coalition, I think is the coalition only for the U.S. For studies is the coalition only for the United States? I think he's referring to maybe all of our coalitions as well as Hep B United. I mean, I can answer right now. Yes, we are focused on populations in the U.S. Our members, our coalition, obviously here, they're all U.S.-based coalitions. Our foundation, has a Hepatitis B Foundation, we do a lot of international work as well. HepB.org. If you want to check that out. And we had talked about African American communities in our earlier, discussion. I do want to direct you to a coalition in the U.S. That you may want to connect with, the Coalition Against Hepatitis in People of African Origin, or CHIPO. And I know New York City, Niki, I think you're active in that as well. So that's another organization that you may want to look towards for more information on how they're targeting people of African origin, so that possibly you can take back to Africa. I have one last question from an audience member, and this is for everyone. And Heather, I'll go ahead. Actually, you might have already answered this question, but I will ask it in a different way. And for everyone else, this person wants to know about barriers. What has been the biggest barrier that you've faced in coalition building? And what are some of the ways that you have addressed them? So Heather, I know you had talked about barriers before, but have you tried anything that didn't work? Why do you think that is?
Yes, and it's similar to something that somebody else said, that we originally had subcommittees that worked on different media and education and screening subcommittees. And then what we found was that it was a lot of our partners telling us what we should be doing instead of taking ownership in the process and in the outcome. And so we found that while there were some, interesting things generated from those committee meetings, we weren't very successful at helping people have buy-in that way. So again, by doing it more virtually, ironically, we've actually gotten more buy-in than the face-to-face meetings, where again, when we ask people directly, do you want to be involved in this event or this issue, people seem to take more ownership over it than when we were doing face-to-face, and it was really easy for them to say, oh, well, you should do this or think about this. And then the other piece that we found is that by coming over that barrier of it's not apathy because there's interest. It's like everybody said, there's competing issues in people's time. Is really finding out, well, what can we do for them? Meaning, how can we maybe help them meet one of their grand objectives, or do something that's helpful for them as an agency or as a project that also is mutually beneficial for the coalition's mission. And we found that the more that we can find, for example, we got permission from the health department that if participants that are also funded for HIV go to this hepatitis B event, they can do that on the time of the grant, the HIV grant, because there still can be links to doing HIV education with that population. Well, that allowed folks to more be able to volunteer and work with us because they were also able to ascribe their time to a different funding source. So trying to think outside the box and find ways to be able to meet some of the needs of our partners has helped us overcome that barrier of the time and capacity issues.
That makes sense. A lot of competing interests there. Matt, what about you? Barriers that you face in coalition building?
Yeah, I think on one hand, I'd say it's hard to answer because what may work for one organization that we work with may not work at all with another, and vice versa. And so I think learning from that and learning that, each organization just like different and works in their own way, that's a good thing. We can learn and work. And then beyond that, echo what everyone at the table has said, priorities, lack of resources, or competing resources, or however you want to frame it, that's clearly an issue. But, it's an issue in a lot of fields and areas, too. So we just got to do what we do our best.
Right. Dallas?
Hello?
Yes, we can hear you.
So I guess one of the issues that we ran into with coalition building is, I mean, initially we started with the Asian community and just trying to expand beyond that, because we started as the APAMSA, the Asian Pacific Medical Student Association, just expanding to like the African communities. We weren't, I guess we just didn't have the right type of members to help us facilitate those expansions. And so finding other medical students that are more familiar with these communities and more knowledgeable and that would be able to do a better job at reaching out to these communities was probably one of our biggest barriers. But I think a lot of that had to do with education also, saying that, you know, this doesn't affect just, you know, the Asian population, you know, the African communities are also, you know, adversely affected by hepatitis B. And so, yeah, just a lot of education.
Makes sense. And if you are still working on that expansion and looking for advice and experts for reaching out to the African immigrant community, of course, now I don't know if you knew about Chivo before, but feel free to reach out to us, or Niki actually can tell you a little bit more about the stakeholders they have in that group and any advice they may be able to provide for your expansion. And Niki, to round it out.
Yeah, sure. You know, I think the Hep B Coalition has been very quiet and less active in advocacy. I don't know if many of the people on the call know, but Hep C has recently in New York State gotten a Hep C testing bill. The Hep B Coalition hasn't had that kind of movement or luck. So I think right now we're really trying to focus and strategize how can we be more visible with elected officials, having member briefings, and then also just getting patient advocates. It's still stigmatized. People don't want to disclose. We're always looking for someone to be the champion.
Absolutely. Personal stories are definitely hard to get. So we are reaching the top of the hour, so we are going to go ahead and wrap up. I don't see any more audience questions, so wanted to thank everyone. If we can go to our resource slide for folks. If you have any further questions, follow-up questions after this, don't hesitate to contact us at connect@hepbunited.org, and you see it there. If you want to reach out to any of our presenters today, we're more than happy to do that and follow up to this presentation. And you can see our website there. We are on social media networks, Facebook, Twitter, YouTube, as well as Instagram. Lastly, I want to thank all of our presenters here today, Heather, Matt, Niki, Jeff, Minh-da, Tyler, and Ellen, I believe. Thank you so much for your time, for sharing your insights and your expertise. I definitely learned a lot, and we'll be using those tips for our own national coalition as we continue to build it and maintain it. So thank you everyone for participating today. We'll continue to have these hangouts in the months ahead. So keep posted by joining our listserv and looking out for our future announcements on topics that you may find of interest. So thank you all again and have a great rest of the day. Bye.